movements of the eyeball is described or seen as movement of the anterior part, changing the direction of the gaze of the pupil and the iris. These movements are produced by 6 of the 7 extraocular or extrinsic eye muscles, which include the 4 rectus muscles. You have superior rectus, medial rectus, inferior rectus, and lateral rectus, and the 2 oblique muscles, superior oblique and inferior oblique, all named according to their relation to the eye. To understand the actions of the muscles on movement on the eye, it is important to know how these muscles approach and where they attach on the eye. It is also important to note the axis of the orbit compared to the anterior-posterior axis of the eyeball itself. The name rectus indicates the muscles that project straight from their origin towards the eye. The 4 rectus muscles originates from the common tendinous ring at the apex of the orbit and then project anteriorly to insert anterior to the equator onto the sclera of the eyeball. The equator here is indicated by the broken line. The insertion anterior to the equator then causes contraction of these muscles to pull the anterior hemisphere in the same direction as the muscle that is contracting. So for example, with superior rectus, the muscle is contracting in a superior direction as indicated by the yellow arrow, and then the anterior half or the anterior hemisphere moves in that superior direction as indicated by the blue arrow. For the oblique muscles, superior oblique originates from the common tendinous ring, but its tendon then hooks around the trochlea before projecting back towards the eyeball. The inferior oblique muscle is the only one that does not originate from a common tendinous ring, but instead originates from the medial part of the floor of the orbit. Both of these muscles have an oblique insertion onto the eyeball posterior to the equator. This then results in contraction of the muscles to pull the posterior hemisphere moving in the direction of the contracting muscle, but the anterior hemisphere will then move in an opposite direction. So again, for example, superior oblique, the yellow arrow indicating the direction of the muscle that contracts, pulling on the posterior hemisphere, but the anterior half with the iris and the pupil moves in the opposite direction as indicated by the blue arrow. Lastly, note the angle or differences in the axes of the apex of the orbit compared to the anterior-posterior axis of the eyeball itself, or also called the optical axis. The apex of the orbit lies slightly medial to the anterior-posterior axis of the eyeball or the optical axis, and then the orbit projects laterally. Thus, the muscles like the rectus muscles do not approach the eyeball from immediately posterior of the eye, but instead approaches the eye from its medial side. Thus, when the eye is in primary position, in other words looking straight forward, the superior rectus and inferior rectus muscles have a line of pull that passes medial to that vertical or anterior-posterior axis of the eyeball. Right, so let's use this model that I made to demonstrate the movements of the eye muscles, the extraocular eye muscles. So firstly, just to orientate yourself, I put a little pink dot. The pink dot indicates the position of the lacrimal gland above the eye. Remember, it's in the superior lateral quadrant. And that will make this is the superior lateral quadrant, that will make this, for purposes of this demonstration, a left eye. Right, so the eye moves around 3 axes. We have the horizontal axis around which the eye will move up and down, so that is elevation and depression. We have a vertical axis around which the eye will move medially and laterally, so that is adduction and abduction. Again, remember this will be the medial side, that is the lateral side. And then we also have an anterior-posterior axis around which the eye rotates. Medial rotation and lateral rotation are also called intorsion and extorsion. So this movement is what you get when you tilt your head, because then the eyes rotate to keep focus on that horizon. Okay. Right, so for the muscles and their actions, let's start with our simpler ones, the rectus muscles. And now remember that the rectus muscles will come from behind, from the origin, the common tendinous ring, and then inserts anterior to the equator on the eyeball. So the rectus muscles pull so that the movement of the eye is in the same direction as the muscle that is contracting. So medial rectus, pulling on that anterior half of the eyeball, I will move medially, so that is adduction, and then lateral rectus will pull the eye laterally again, so that is abduction. Then for superior and inferior rectus, also coming from the common tendinous ring, again attaching anterior to the equator. So superior rectus will pull that anterior half in the same direction, so pulled upwards, that is elevation, and inferior rectus will pull it down, so that is depression. But then for superior inferior rectus, there's also a secondary action. These muscles don't approach the eyeball from immediately posterior to it. The eyeball looks forward, but the apex is situated at this angle. So the muscles approaches the eyeball from this angle. So for the superior and inferior rectus muscles, that angle that they approach the eye also enables them to have a slight inward action on the eye. So superior rectus can also slightly have medial rotation, and inferior rectus a slight lateral rotation. But also when these muscles work together, it cancels out that upward and downwards action. When they work together, that angle that they approach the eye also enables them to adduct the eye, pulling on the eye in that medial direction. Then for the oblique muscles. Superior oblique is the muscle that hooks around the trochlea, so I'm going to use my elbow as the trochlea. So superior oblique hooking around the trochlea and then attaching or inserting on the posterior hemisphere, okay, the posterior half posterior to the equator. So for the oblique muscles, when the muscle contracts, pulls the posterior half of the eyeball and the eye moves in an opposite direction. The iris and the pupil that we look at when we look at the direction of movement moves in the opposite direction to where the muscle is contracting. Right, so superior oblique, this angle that it approaches, look what happens to the eye when the muscle contracts, pulling the posterior half, but the anterior half moves down and out. So superior oblique depresses and abducts the eye. Also look at the pink dot. So another action of superior oblique, by this movement of the eye, the pink dot rotates inwards, so that's medial rotation or intorsion. Then for inferior oblique is the only muscle that does not originate at the back from that common tendinous origin. It comes from the medial side of the orbit and almost cradles the baby. So my arm cradling the eyeball like you would cradle a baby. Again, inferior oblique inserts behind the equator, so the action will be in the opposite direction of where the muscle is pulling. So inferior oblique muscle contracting, what happens to the eye? The iris moves up and outwards, so that is elevation and abduction. Or also, if you look at the pink dot is rotated laterally. So lateral rotation or extorsion for inferior oblique. Then again, there's a secondary action or action in combination. When these two muscles work together, what action did they have in common? Superior oblique, depressed and abducted, inferior oblique, elevated and abducted. So in combination, both of them has abduction in common. So both of these muscles working together will also abduct the eye. So that is their secondary action in combination. Right. A few things to remember regarding movements of the eye. The actions were described for these muscles acting alone, starting from the primary position, in other words, with the eye looking straight forward. However, these muscles rarely act independently, but mostly, almost always work together in a synergistic or antagonistic action to produce specific movements. During clinical testing of these extraocular eye function, movements have to be isolated to ensure that functioning of only one muscle is tested at a time. And lastly, to ensure that both eyes always look in the same direction, it requires a coordinated action of opposite muscles working on the two different eyes at the same time. Then lastly, remember that when your two eyes work together, it's sometimes, mostly, different muscles working on the two different eyes at the same time to ensure that the eyes are looking in the same direction at the same time. So when you look up and down, it will be similar muscles for elevation and depression. But when you look laterally, horizontal gaze, if I look towards my left eye is abducted, my right eye is adducted, and then turning my gaze to the right, my right eye is abducted, but my left eye is adducted. So it's different muscles or opposite muscles for the opposite eyes to ensure that the eyes look in the same direction, and it is this well coordinated movement of the eyes.